Today, we are going to look at a BodyViz Brain Builder about the adrenal glands and Addison's disease. The adrenal glands are part of the endocrine system. The endocrine system is composed of ductless glands that release chemical signaling substances, termed hormones, into either the interstitial fluid, lymphatic system, or cardiovascular system. These hormones then diffuse away from their sources and exert their chemical effects at a group of cells or an organ that is either in close proximity to the endocrine gland or distant from it. The adrenal glands sit on the superior pole of each kidney and are surrounded by perirenal fat, which is fat surrounding the kidneys, and are separated from the kidney by a thin sheet of connective tissue. The left adrenal gland is the larger of the two and is semilunar in shape. The smaller right gland is pyramidal in shape. The diaphragm is posterior to both adrenal glands. The left gland lies posterior to the pancreas and part of the stomach, while the right adrenal gland lies posterior to the inferior vena cava and the right lobe of the liver. Histologically, the adrenal glands are composed of an outer adrenal cortex and an inner adrenal medulla, each of which has a different embryonic origin and produces different hormones. The adrenal cortex secretes 5 steroid hormones, which include aldosterone, which is a mineral-low corticoid that exerts its effects on the kidneys' handling of sodium, potassium, and hydrogen ions. Cortisol and corticosterone are classified as glucocorticoids due to their effects upon the metabolism of glucose and other nutrients. Dehydroepiandrosterone, which is abbreviated by the letters DHEA, and androstenedione, which are classified as androgen hormones. The adrenal medulla secretes 2 hormones, epinephrine and norepinephrine, which are classified as amine hormones. Addison disease, often also referred to as Addison's disease, is a rare condition that can be fatal if not promptly diagnosed and appropriately treated. With Addison disease, the adrenal glands do not produce enough cortisol and often too little aldosterone. Addison disease can typically occur in the 20s or 30s of a patient. Next, we will look at the symptoms, causes, and treatments for Addison disease, and finally give a patient example. Early Addison disease typically presents with 1 or more nondescript symptoms, such as fatigue, weight loss, nausea, generalized weakness, abdominal pain, and/or dizziness. This often delays an accurate diagnosis. All too often, the proper diagnosis is not arrived upon until the patient presents with an acute adrenal crisis. The cause of Addison disease is often from a primary adrenal insufficiency, where an autoimmune disease attacks the adrenal cortex, or an acquired secondary adrenal insufficiency, which can be the result of type 1 diabetes, sepsis, tuberculosis, celiac disease, and other diseases. Both primary and secondary adrenal insufficiencies can result in the bilateral death of the adrenal cortex. Treatments for Addison disease all involve medication for hormone replacement therapy to correct the levels of hormones the body isn't producing. Some options for treatment include oral corticosteroids to replace cortisol and aldosterone. These hormones are given on a schedule to mimic the normal 24-hour fluctuation of cortisol levels, and an increase in sodium or salt intake, especially during heavy exercise. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age 22, sex male, chief complaints excessive fatigue, craving salty foods, weight loss, and depression. You invite the patient into your office for an examination, and you talk to him about when he began feeling unwell and noticing the fatigue and depression. Your patient explains how it has gradually occurred over time. He could not really say a specific time he began feeling this way, except for that he has felt this way for a couple months now, with it progressively getting worse. Your patient's lifestyle is incredibly busy and stressful. He's a full-time medical student, working a part-time job, and also managing his type 1 diabetes. You send for some blood work tests to be run to see if the results can show you a possible culprit to these symptoms. After running several series of blood tests, you piece together a diagnosis based on low sodium, potassium, cortisol, and adrenocorticotropic hormone, which is his ACTH levels. You diagnose this patient with Addison's disease and prescribe him hormone replacement medication to help him supplement the lack of cortisol and aldosterone his adrenal glands are not producing. The medication helps your patient's energy levels return back to normal, and he has frequent check-ins with you to make sure his medication is at the appropriate level for his current lifestyle. This is a classic example of Addison's disease. Like this video? Consider looking at BodyViz 3D Anatomy Dissection Software, used to showcase 3D visualizations from a real person. To learn more about BodyViz and what other resources we have available for instructors and students, go to bodyviz.com.